Welcome to Marsupial, an electronic medical record software you'll be using. Marsupial is similar to the charting system you'll use in real clinical environments. Since all EMR software is different, I'll be showing you around Marsupial so you'll be prepared to use it in lab. This is the main screen. The patient list will show you available patient charts to view. You can double-click a patient to open their chart. Once opened, their information will appear in the info bar and other tabs will be available to browse. This is the Notes tab. Narrative notes are available to be viewed, like physician progress notes and nursing notes. Double-click a note to view it. You can also create a new note by clicking New Note and filling in the appropriate information. Once you fill in the information, click Save, and the note will appear in the list. This is the Orders tab. Provider orders will be shown here to review, as well as the time the order was entered and the order status. Discontinued orders will be crossed out, while completed orders will be italicized, if selected to be shown. Orders will be grouped according to the order category, such as laboratory, medications, nursing orders, nutrition, and respiratory orders. This is the Results tab. You can view your patient's lab results here. Results are grouped by lab type, such as hematology or chemistry. The most recent results are shown on the left. Normal ranges for labs may be shown next to the lab, or by hovering over the lab result, depending on your instructor's preference. This is the Imaging tab. You can view diagnostic imaging, like EKGs or X-rays here. Double-click an imaging test to see a narrative report and the related image. You can zoom in and out of the image by scrolling the mouse wheel. The image can be moved by clicking and dragging. Opening another image will reset the view. This is the Flowsheets tab. This is where you can view and document any patient flowsheet data. There are multiple flowsheets available. Here is the Vital Signs and INO flowsheet. Most recent time columns will be on the right. You can document new data by clicking the New Column button and entering a time. The current time will be automatically entered. You can create the column by clicking OK. You can now chart available data in the column that was just created. Let's document a heart rate of 75 BPM and pulse ox of 97%. Click the row you wish to document and hit Enter. If you make a mistake, you can go back and type over what you entered. Once you've entered all information into the time column, hit Save. Make sure you enter all data into the column before hitting Save, because you won't be able to go back and edit that column anymore. This is the Assessment flowsheet. You can document assessment data here just like Vital Signs, by clicking New Column. Each body system will have its own category. We have neurological, respiratory, cardiac, and so on. Marsupial uses a chart by exception philosophy. Each category will have a WDL or within defined limits row. If you hover over the WDL that's bolded, it'll give you a WDL definition. Let's document that the patient is disoriented to time. I can hover over the bolded neuro WDL row to see what's considered within defined limits. I'll enter WDL except and type disoriented to time in the orientation row. All documentation is freehand text, so there are no buttons or checkboxes to select. If you have other data to enter in this column, enter it before saving. Make sure to hit Save before moving to another part of the chart. Remember, you won't be able to edit old columns, you'll have to make a new time column to document additional data. This is the Medication Administration tab. You'll be able to see the MAR and administer medications here. Only today's medications will show. Medications are grouped by whether they're scheduled, continuous, or PRN. Bolded times indicate a medication is due to be given at that time. Green boxes mean a medication dose was administered. Red boxes mean a medication dose was held. The scanning interface is on the right side of the screen. To administer medications, scan the patient's wristband with the barcode scanner, or type in the medical record number. If a match is found, we can start scanning medications. If you have trouble scanning, make sure the cursor is in the scanning box. The clock on the top left shows the current scenario time. There are several 9 o'clock medications due. We have aspirin 81 mg and atenolol 100 mg due, and several others. Let's administer the aspirin and atenolol. Scan the aspirin tablet first. A confirmation box will pop up showing what you scanned, and all the orders for aspirin available to be given. Select the order you wish to administer. Because we scanned 81 mg of aspirin, and the order selected as for 81 mg, we have a dose match. Once matched, there are options to give the medication, hold the medication, or cancel if a mistake was made. Click Give Med to add it to the administration list on the right. Let's give the atenolol next. Atenolol comes in 50 mg tablets and our order is for 100 mg. Let's scan the first tablet of atenolol. The confirmation box pops up asking us to select the order we want to administer. There are 2 doses scheduled today, so let's give the 9 o'clock dose. We only scanned 50 mg of the 100 mg dose, so let's scan the next 50 mg tablet. We now have 100 mg total scanned and it matches the order. Click Accept and then click Give Med. Now atenolol is added to our administration list on the right. The patient is also due for docusate sodium. Let's say the patient refuses to take the scheduled docusate and we need to document it as held. We can scan the docusate, select the order we want to hold, and click Hold Med. We need to enter a comment on why it's being held. Now docusate is added to the list on the right, but it's crossed out, indicating it will be marked as held. Once all medications are scanned, click Administer Medications. Enter your initials to sign off the administration. Now the aspirin and atenolol we just gave are green and shown as given. The docusate that was held is red and marked as held. If you need a calculator for any reason, click the calculator button on the top right. There's also a link to a drug guide if needed. Type the part of the generic or brand name of the drug and click Search. Click the name of the drug to see more information about it. If you need to check IV compatibility for a drug, click the IV Comp button. You can check compatibility of 4 drugs at once. Select the drugs or fluids and click Analyze. Green means the drugs are compatible. Red means incompatible. And yellow means compatibility is uncertain. Lastly, the New Results, New Orders, and New Imaging flag buttons are located in the top right. These will highlight red if new results, new orders, or new imaging become available during a simulation. For example, if you call the physician and are given a new order, or draw blood from the patient, your instructor may tell you to press the Next State button during the simulation. This will change the chart and may release new orders and results. Be sure not to press this unless your instructor directs you to. Let's say our instructor told us to press the Next State button. We'll click the button and hit Yes. It looks like we have new orders from the physician and new results, so let's click the New Orders button. New orders will be listed here. Click the OK button to mark these as viewed and to update the EMR. There are also new results to view. Once reviewed, click OK to mark these as viewed. The new orders and results can be viewed in the Orders and Results tab as well. Alright, that's everything with Marsupial. Be sure to follow your instructor's guidance for what documentation is required during lab or simulation. For example, if you're required to document an assessment, or if you need to write a nursing note.